Nothing breaks our hearts more than seeing our little ones up late at night crying, tugging on their ear, and just wanting some relief from the constant congestion and pain caused by an ear infection. Once you've experienced even just a time or two as a parent, now you begin to worry like mad every time they get a slight bit of congestion or a common cold, worrying it may spill over and build up into a chronic ear infections again and again. For many parents, that's exactly the case. Round after round of an ear infections, followed by round after round of pediatrician and ER visits, and of course, round after round of antibiotics and all the side effects that come with them. By age 3, it's estimated that somewhere between 80 to 90% of kids will experience at least one ear infection, which should then get us to asking the real question of what's different about the 1 out of 10 kids who do not get ear infections. If you'd like to stop the cycle of chronic ear infections or prevent them altogether in the first place, then you've got to watch this video all the way through. Let me tell you a story about Luca. Luca came to us because he was getting an ear infection every time he got sick. At one point, he had 5 ear infections in 4 months. His mom felt so bad because he would wake up in the middle of the night screaming in pain, and even after going on antibiotics, it would clear up the infection just to come back again. The next cold or virus would bring on another ear infection. He was on the antibiotics back to back for months, and she knew that this wasn't good for him long term. The pediatrician then again suggested going to see an ENT and talking about getting tubes and possibly a different surgery as well. But she wanted to avoid this route if she could. So after hearing about pediatric chiropractic care, she reached out to see if it could help with the recurrent ear infections. Since they started chiropractic care, Luca has not had a single ear infection. He still gets sick, of course, like every kid does, especially preschoolers, but the colds never turn into ear infections. He also is able to get over the colds a lot quicker. His immune system is so much stronger as he's experienced less frequent illnesses since they've been doing consistent chiropractic care. And when he does catch something, a couple of extra boost adjustments helps get them over the hump and back to good health quickly. Let's talk a little bit about the science behind ear infections. So there's many ways to help kids get through ear infections without antibiotics, surgeries, and all the side effects that come with them. The natural solutions and options not only help get through the challenges, but they make the body stronger as a result of it. Chronic ear infections occur when there is recurring buildup of fluids, inflammation, and swelling that block the eustachian tube, leading to pressure and pain in the middle ear. This condition is also known as chronic otitis media. There's 3 primary causes of chronic ear infections that are all tied to something called subluxation. First, there is poor plumbing or drainage that results from the misalignment, causing extra tension, inflammation, and limited movement of the nerves and muscles that supply the inner ear, leading to a buildup of fluid. Second, the subluxation also causes the body to go into an excessive sympathetic fight or flight state, leaving it in a high inflammatory state and producing extra mucus as a result of it. Now, if you combine not having an ability to drain with extra mucus that needs to get drained, then we have a problem starting. Lastly, the world we live in has a ton of toxins, sugar, dairy, so forth. Those stir the pot. It's kind of like having stagnant water and then adding in a ton of bacteria. Now we've got things that are brewing. So, since antibiotics and fever reducers do not take care of the root cause head on and in fact make the gut and immune system weaker over time, they are a major reason for recurrent of chronic ear infections continuing to come back again and again. In the same way, many families have gone gluten-free, dairy-free, added tons of supplements, essential oils, all the things, and they still struggle, showing that those things may be helping some, but do not address the root cause or subluxation entirely. It's all about that drainage. Our adjustments are designed to provide two main things that help kids and patients get to the other side of ear infections without drugs or surgery. One, they increase the drainage or the plumbing by getting things moving and clear once again, often immediately. Second, they balance out the nervous system and help reduce that sympathetic fight or flight state, reducing the inflammation, and just overall take care of the stress and tension that's in the nervous system. So once we can address that, the body can drain all that extra mucus, and now we don't have any stagnant mucus sitting there for bacteria to grow in. In our office, the path to natural solutions and overcoming chronic ear infections begins with what we call our neurological insight scans. These scans directly measure stress, tension, inflammation, and subluxation so that all that often build up in the upper neck of infants and children struggling with chronic ear infections, stemming all the way back usually from birth interventions like forceps, vacuum, C-section that can create physical tension, twisting, pulling in the upper neck and middle ear areas, leading to all this trouble in the first place. To learn more about how chiropractic can help your child overcome these challenges and to get your child scheduled for their neurological insight scans, check the link in our bio and head to our website.